I'm Abby,
I'm Yukiko.
I'm Alana.
and our person was Mark Munson. We had diagnosed him to have Alzheimer's dementia. Mark Munson is 78 years old and was born on April 15, 1935. He's a retired mathematician, and he takes warfarin for blood pressure and Lipitor for cholesterol. He hasn't had any medical procedures pertaining to his neurological health, but he did have a stress test to determine his cardiovascular health. His family has noted that Mark Munson has had extreme mood swings and lots of confusion. He doesn't recognize friends or family and mixes up lots of names. He refuses to shower or put on clean clothes and believes that he has already showered. He has trouble locating everyday items and loses many objects. With these symptoms and his age in consideration, we believe him to have Alzheimer's dementia. His moodiness, forgetfulness, and confusion led us to this conclusion. His mental status testing can also be used to reinforce this belief.
Parts of the brain affected. People with Alzheimer's have loss of judgment, loss of memory, slurred speech, and loss of ability to voice their thoughts, which affects the frontal lobe, temporal, and parietal lobe. Alzheimer's dementia is a disorder that slowly destroys memory and thinking skills. Daily activities become harder. Alzheimer's has 3 stages: preclinical stage with no symptoms, mild cognitive impairment, Alzheimer's dementia, thinking and remembering. Error in communication that causes Alzheimer's. Protein clamping together, forming tangles and plaque, and these block electrical signals communicating, making memory, thinking, and learning harder.
For prognosis for Alzheimer's dementia, the life expectancy for patients diagnosed above the age of 65 is about 4 to 8 years, and in rare cases, people can live up to 20 years after they're diagnosed. However, in most cases, you're in that 4 to 8 range. And oftentimes, patients die from pneumonia or the flu, and if not from that, patients will die once their bodily systems start to degenerate because of the disease. Professionals needed to treat and diagnose Alzheimer's includes neurologists who specializes in disease of the brain and nervous system, psychiatrists that specializes in disorders that affect mood or the way the mind works, psychologists who have special training in testing memory and other mental functions, and then the caregivers who give assistance with the non-medical process of the diet of the disease. And this is our works cited page.